Hi, my name is Dr. Jennifer Gramis, and I am here today to share some more video testimonies about assisted lymphatic therapy. And today, my guest is Fran King, an assisted lymphatic therapy from Texas. Welcome, Fran. How are you today? Oh, hold on just a second. There you go. Say it again.
Thank you, Dr. Grammett. I'm so happy that I'm getting to talk to my mentor again and see you again. I love Right Way Health and you and Lauren, and you always make me feel so good. I can always call and ask questions, and you're very good mentors, and I appreciate what you're doing. But I am from Paris, Texas. I'm northeast, about 100 miles northeast of Dallas, Texas. We're right on the border with Oklahoma. So we have patients that come from Oklahoma, and of course anyone would be welcome to come to our clinic. I'm working for Exact Therapy and Aquatics, and it's a large facility that houses PTs and OTs and PTAs and CODAs, and they're doing all types of therapy for all types of different things. We are located in Paris, as I said. Let me give some contact number just in case.
Okay, go ahead.
Call us. Our office number is 903-782-9922, and our email is www.exacttherapy.com. It's actually .net. It is Exact is XZACT therapy.net is what it is. So we'd be glad if there's anyone in our area. There's not a lot of us in Texas, and so if you need help with lymphatics, we would love to help you.
Awesome.
I'm a retired educator, teacher, coach, school counselor. So this is kind of away from what you would think I would be drawn to. But when I retired after 34 years, I decided that I wasn't ready to retire. And so I started working for a national nurse practitioner here in the area. And through that, I met Dr. Grammett at an ACIM conference. And there I learned about the lymphatic system and our XP2. And I was excited about it. And then here I was in 2018, just soon after, and I was training with her and Lauren in Georgia. And so here I was, they pulled me through the training and was lacking the medical background. And so then I started working for Exact Therapy and Aquatics, getting to see a lot of different symptoms, patients, different things going on there.
Right. So with Exact Therapy, this is a physical therapist office. How does assisted lymphatic therapy fit in with manual lymphatic therapy there?
Well, I was welcomed with open arms. They have to do a lot of manual therapy because, when someone comes and they need help with lymphedema, that's their go-to, and which is a very good therapy. With that and the wrapping, and it does work, but it's very labored for them. It takes a lot of time, and it has a lot of patience on the patient's part. So they were very glad to see that I could cover a lot of ground in a short time and go into the deeper lymphatic system.
Awesome.
So
awesome.
That's how it fits. They love me.
Yeah, makes them look really good in their job of much.
They know now. They don't dread that call when they come in and say, we have someone referred for lymphedema or lymphedema. They're like, oh, good. We got somebody that can help this. They love that.
Yes, I do too. So what type of clients have you seen a benefit on? So at the nurse practitioner's office, I know that you did a lot of detox programs. So this is a therapy that you can just do for general detox and prevention, which all of us should be doing.
Right.
But what other types of cases or symptoms did you see were eliminated from assisted lymphatic therapy?
Well, I did see it. I have seen a lot of different ones. Seems like every day it's something different. But one of the things that I think is most different from what I thought that I would be doing is wounds. And I've helped a lot of people with wounds getting those well quicker, and fractures, prostate, problems with prostate, and then of course the lymphedema. Also a lot of ladies that's had mastectomies, and they come in with the swollen arms and the heavy arms and tightness in their chest and their back area. So a lot of different things. I mean, lots of different ones.
Right. You know, one thing that because I'm a manually trained lymphedema specialist too, and so I've used bandaging and compression, and then like you said, it works really well when patients are compliant. The hardest thing that I had was the compliancy of the patient. They didn't want to come in every day for an extended period of time, leaving with bandages and compression. So how compliant are clients with assisted lymphatic therapy versus manual that you see?
They love this therapy because they come in and I have a little dark room, you know, and it smells so good and it's so cuddly. They love it. It's just like a massage. And, you know, at first they're nervous when they first come in because they don't understand it. But once they've had one treatment, then they're very compliant. I have very few that cancel their appointments because they like to come in and see me and just get their, you know, sometimes they want to stay after the therapy, but they're very comfortable. Yes, take a nap.
Yes.
They usually do fall asleep during the therapy.
Yes, I have had many times.
They don't want to flip over when they're like that.
Exactly.
Right.
And the fact that it's a full body approach, you're addressing the entire lymphatic lymphatic system instead of just one extremity. And so I think that is very important to point out. So I've asked you to share a testimony, and you have an amazing testimony, I believe. So go ahead and share your testimony with us.
Yes. This lady has been coming since September, twice a week. So it's been about 5 months, I guess, that she's been coming. And she's been coming to see the PTs and the PTAs, OTs. And they've been helping her with strength training. She's been doing exercises. She had been doing some manual. They'd worked on her manually before that I started seeing her in September. Her lower extremities were very swelled, discolored. Her mobility was slow and very, very slow. She has a cane. She walks with a cane, but she is very, very bright and really, really quick, witted and all. I love her. She comes and we started the therapy. So the first day we did the therapy, they told us that we've got a different thing we're going to try, and she was very willing, and I got to meet her. And we come in and we tried the therapy, and just as soon as she finished, well, she hopped off the table and was headed to the restroom, and she just turned around. She goes, she said, oh, I can't believe it. She said, I can't believe how I feel. I've not felt like this in months. And she hugged me, and both of us teared up, and she was very grateful to find something that could help her that quickly. So we began doing the therapy every week for the 5 months, and we're continuing that. And she has seen her swelling has gone down in her legs. In fact, the measurements show that she has lost over 22 centimeters in one leg and 26.5 in the other leg. And that's the sum of the measurements from September until February. Is the end of February is when those measurements were taken. So she's been very, very pleased with that, very pleased. This lady was kind of my all symptom lady, because during this time she stumbled, and some bees got after her, some wasps, and she stumbled to get away, and she fractured her arm, her wrist. So we started working our lymphatic on, we would take her little soft cast off and work on that wrist, and we got the swelling down, and got her mobility back in that very quickly using the XP2 on that. And then down the road a little further, she dropped a piece of wood on her. She was feeding the wood into the fireplace, and she dropped some wood onto her leg, and it took a chunk out of her leg, a terrible wound. It was very deep, and it looked really wicked for a couple of weeks. And so we laid off the lymphatics for about a month probably, and then we began, and as soon as we got to doing that, it seemed to the healing started quicker. It started healing from the inside out. And you could start seeing it in Dr. Zach Michael, that is the owner here. He would do the checking the wound and packing the wound, and he would keep saying, "Oh, it's looking better, it's looking better." And now, yesterday I saw her, she has a small little Band-Aid on that, and it was like this huge, I mean, it was awful.
Awesome.
So he is very, very pleased with all that. In fact, I have a letter. Would you like me to read that?
Yes, please share it.
Okay. You get so attached to these patients, very, very attached. I want them to get well, but then I want to keep them, you know. She says, I recently came under the care of Fran King as one of my therapy sessions on Thursdays. I wanted to express how much I feel her therapy has improved my overall health issues. The first thing I noticed was the decrease in the swelling of my feet and ankles, which was an ongoing problem. She took the time to explain the lymphatic system and what she was hoping to accomplish using a chart of the system. She was very knowledgeable, but the bonus she gave me was the infection in my leg that we had been working on for months at earlier sessions was amazingly healing at a much greater rate from her using her XP2 machine, or her therapy machine. Fran has been an inspiration to me also spiritually, to remember that there are 3 persons involved in my healing. Thank you for the effectiveness of this type of therapy. Susie.
Awesome. That is
So,
great testimony.
Yes,
Yeah.
it is. Great.
It just warms your heart to be able to impact, someone's life so quickly like that. I had another case study was similar. She had such poor mobility due to the swelling in her legs. She couldn't even hardly walk and get around. And so she kind of just stayed in her house because it was so uncomfortable. And after just a few sessions, she was able to walk almost a mile around her neighborhood and meet and talk to her neighbors. It doesn't sound like that big of a deal, but it is
a big deal.
When you can, when you're confined to your home and you just have no hope, and then all of a sudden you feel better and you're stronger, and the fluid is gone. One thing I don't think a lot of doctors realize is that lymphedema is very difficult emotionally for patients, especially women, because it's a disfiguring disease.
Right.
And it shouldn't be that way. We should be able to diagnose very early on. And now we have tools, and I'm sure they have similar tools like I use, that actually measure the fluid in the interstitium. Right. And we can see the early stages before you can visibly see it. We can now see it start to develop and prevent lymphedema from ever happening, which we haven't been able to do in the past. In the past, typically they don't come to us until they're in stage 4 and they're a mess, and it takes some time to repair. But yeah, I'm super excited.
I have some that are in stage 4, a couple that are in stage 4, and their legs are so large and all that. I'm working on getting as deep as I can, but till we get those, the swelling down, we're not getting the soldiers out doing what they need to do.
Exactly. And it takes a good, 6 months to a year for a typical stage 4 doing the therapy. And so, as long as they stick with it, they will get the results that they want to see, but it is time consuming. So, we want to be the pioneers that really get out and train the doctors to identify the very first stages, and not only train the doctors, but train the clients to know
Right.
that, hey, yeah,
Right.
if
Don't
your
wait.
legs, yeah, don't wait. If your legs feel heavy, even before you can see it, get to a assisted lymphatic therapist or a lymphedema specialist like Dr. Zach and get some help before it evolves into a more dangerous disease, because lymphedema is very hard on the
Yes.
circulatory system.
Yes.
And
Yes.
so, well, thank you, Fran, so much for joining me and sharing this beautiful testimony and just your experience that you've had with assisted lymphatic therapy. It's always great to talk to you. And I encourage you to continue to share testimonies with all of our practitioners around the world. So we created this forum, guys, to help you get to know each other and to learn the different uses of assisted lymphatic therapy. It is not just for lymphedema. It's not just for cancer patients, just for diabetics. There is so many conditions. Any condition that has to do with an inflammatory process can be benefited with assisted lymphatic therapy. And I believe it, just like Fran, it's the foundational therapy. Start with the lymphatic system, and every other modality, every other nutritional supplement or diet style will work much, much better. Wouldn't you agree?
Yes, I do agree. Hey, thank you so much for having me today too. And hello to all the other ones out there that's working hard. And I appreciate you and Lauren too for helping
I will tell Lauren
mentor
that.
me. Yes, tell her hello for me.
And you'll see Lauren on the forum. She's going to be interacting and doing some of the interviews in the future. So
yes, and I appreciate the level 2. I have been using that a lot on the rerouting.
right.
That is working really well with my oncology mastectomy
Awesome.
patients.
Awesome. All right. Well, we thank you all, guys, and we look forward to the next video testimony. Thanks.
Thank you. Bye-bye.